The cerebral cortex, or gray matter, is where brain cells, referred to as neurons, are located. These cells talk to each other and make up what are referred to as networks. In normal neuronal networks, there is a balance between inhibitory and excitatory impulses. In epilepsy or seizure disorders, the normal networks become hyperexcitable networks. A network may become abnormally excitable because of abnormal cells or abnormal external factors that alter neurons' excitability. An imbalance of inhibitory and excitatory inputs may lead to a hyperexcitable cell and an excessively excitable network. When multiple cells in a network fire together excessively, it may lead to electrical and clinical seizures. Focal or partial seizures are events which begin with abnormal electrical discharges that come from one area of the brain. These are the most common seizures. A generalized seizure begins with abnormal electrical discharges beginning on both sides of the cerebral cortex simultaneously. These discharges may spread down neural pathways to involve the spinal cord and cause diffuse shaking movements. A focal seizure may become a generalized seizure, but we categorize epilepsy as generalized epilepsy, about 30% of all epilepsies, or focal epilepsy, by where the abnormal electrical discharge begins. The location of the electrical abnormality is detected with an electroencephalogram, or EEG, which is a device that measures electrical activity in the cerebral gray matter. EEG tests can be brief or can last several days, with prolonged monitoring being most informative as it allows more time to detect and identify disturbed cortical discharges and evaluates the patient during important sleep cycles. It is important to classify type of seizure and epilepsy because seizure treatments such as anti-epileptic drugs or surgery depend on the type of epilepsy.